All right. Well, on today's episode of the Strong Serve podcast, we have a very, very special guest, someone that I know from way back, Dr. Chastity Guillory. Clap it up for her, friends. We're going to discuss a lot of different topics. We're going to talk a little bit about our past. I have a geriatric expert here, a certified expert on aging adults. And we're going to talk about getting back into sport, getting back into pickleball if you're an older adult and what that means. We're going to talk about the Senior Olympics. First, I want to start off asking you, Dr. Chastity Guillory, who are you? What can you tell us about yourself and who do you serve?
Okay. My name is Dr. Chastity Guillory, Doctor of Physical Therapy, and I specialize in geriatric physical therapy. I'm based in Waxahachie, Texas, and my company is Goal Life Therapy. And my entire goal is to just service the older adult population. And the goal is for them not to feel like aging is a death sentence, but it's really a privilege in that it's not, a time where you have to stop doing everything or you have to expect to be decrepit and falling apart. We all get injuries and things like that, but I think that through therapy, through activity, through adequate nutrition, things like that, you can still live an optimal life at any age because age is nothing but a
Amazing.
number.
That's right. That's right. And I know that the name of your business is Goal Life Therapy. Tell us a little bit
Mhm.
more about that.
So, as a therapist, we're always asking our patients, what is your goal for therapy? What do you want to be able to do? It's basically built into our profession. Our goal is, your goal is our mission. So, whatever you want to work on and improve on and accomplish, like we're your cheerleaders. We're just here to help you get there. So, that's where Goal Life Therapy came from.
Awesome. Well, if you guys might not know, but actually I've met Chastity a long time ago. I'm also a doctor of physical therapy, and I'm also a geriatric specialist. And we actually met at a hospital in North Miami called St. Catherine's Rehabilitation Hospital. We got trained by some of the best therapists around, actually. So we're gonna name drop them.
Yeah, for sure.
We got Gemma Longfellow and Greg. Greg is all was the director of the residency. He also working at U of M as well. We had great times, and I remember Chastity being in the residency at the hospital, and I was also a part of the hospital there, so we got to know each other and really work on the population that we specialized in, which was geriatrics. We call them lovingly, we call them Jerry's, but we love older adults. We think that at any age you can get strong, especially after people think that after 40, after 50, you stop growing, you can't grow any muscle, and that's just not true. You can definitely improve, you can grow muscle, you can live an active and resilient lifestyle. You can play pickleball at a high level, okay? There's people on Instagram showing you or social media showing you how to play pickleball, 90 years old killing it, beating us,
Yes.
young people. So it can definitely be done. So, and actually, one of the big things that we did in North Miami, we participated in the Senior Olympics, right? The
Hmm.
residents. Can you tell us a little bit
Yes.
more about the Senior Olympics?
Yeah, so I never heard of the Senior Olympics. Like
Me neither.
going into the residency, I'm like, okay, I'm gonna learn how to treat the older people and thinking about like hospitals, nursing homes. And they were like, oh yeah, we're gonna go like do fall screening and stuff like that at the Senior Olympics. And I'm like, excuse me, like what is this? And so I think it's annually. I really need to look into it some more since then. But seniors of all ages were doing a myriad of sports. So they had track, like the running sports, the jumping sports. They had pickleball tournaments. I mean, these older people, like all you saw was white hair everywhere, and these people running, jumping, like going at it. And they're serious, like they're not playing around. I think it was in Clearwater, Florida, I think.
Yeah,
And
Clearwater.
so
Yep.
it was just an amazing experience to know there's a community of older adults that are still like living active. And they're coming from like all areas of the country to participate in these events. And of course, this is not like a weekend thing. So obviously
They're not
they're,
just weekend
doing
warriors. This is a
Yes,
lifestyle. Yeah.
exactly. So it's a lifestyle, and then they get to showcase their skills and the work that they put in at these Senior Olympics. And so I just thought it was such an amazing experience, and like, I couldn't get enough of it. I enjoyed it. I enjoyed seeing them, the competitive edge. It made me feel good to know that, like, when I get older, like, I am not stopping. Like, I got things I still want to do too.
Yeah.
So we'll keep doing it.
And the age that is they start with is 50 years old, right? For the Senior
I think
Olympics,
so.
yeah.
Either 50 or 55, one of those.
Right. And it's like 30 something sports. And pickleball is one of the sports at the Senior Olympics, by the
Yes.
way.
Yes. It was huge. I saw they had their tournament. And so they had their bags, their paddles, like they like club teams. They
I
are
love it.
serious. They're
I love
serious.
it. And you can really be serious about living an active lifestyle as an
Hmm.
older adult. Once you hit 40, life doesn't end, people. Friends, life doesn't end. And there's so much you can do. Chastity, can you tell us what do you think about older adults? Somebody that is, 40s, 50s, 60s, returning to, getting into pickleball or some sort of sport or some sort of activity. What would your advice be for those people?
Well, first off, you know, like again, as I said before, you can play at any age. And like you were saying, you can start at any age. So like I play on a soccer team with 70-year-old women, and they've been playing for like 30 years. So if you've been playing sports, of course, it's a little easier to transition into doing that like later in life because you kind of have like the routine of it. But if you're just wanting to get into the sports, I would just say kind of ease into it. Like, don't go out trying to be like that
Exactly.
weekend warrior because that's
Exactly.
when the injuries happen. So not even just for sports, like if you're going to start lifting weights or doing yoga or doing Pilates, all
Great
these different
advice.
activities. If you
Yes.
haven't done it before, don't go to the advanced stages immediately. Like you have to work your way into it. And then the I guess the basics is if you're going to do any sports, any physical activity, you got to warm up, then you do your
Hmm.
activity, and then you have to cool down. That's kind of like the ABCs of any physical activity you do, just to prevent injury. So in addition to that, you have your sport that you play, and it's really good to maybe do activities that mirror that. So, say for instance, you're playing pickleball, you go into the gym just to lift weights may not necessarily transition to
Exactly.
playing pickleball because you could be strong, you could be swole, but what about your agility? What about your
Yeah.
flexibility? What about your
Right.
balance?
Yeah.
So that's what I would say for sure.
Yeah, and just piggybacking off just to piggyback off the last thing you said, I notice a lot of older players when they're playing pickleball, they're great, but the ones especially that complain about back pain, I
Mhm.
notice that they're really getting at the ball. They're bending at their hips. They're not using their knees. So it's really increasing their low back pain. And
Right, right,
so they're just not used to, going to the gym and warming up it's not just about doing that. It's about
right.
getting used to your body, that
Yeah,
self-discovery, right?
yeah.
Getting reintegrated to your body. Do you have anything to say about towards, just getting to know your body and especially as an older adult returning to sport and what that means for you just being better at your activity and your hobby that you're planning to do?
Yeah. Well, I mean, I may be biased as a physical therapist. I mean, but like a lot of people think of physical therapy either like massages or you only go when you get injured. But you can actually see a therapist kind of like like a little bit of preventative. Like usually it's going to
Hmm.
maybe be your private therapist, sometimes insurance doesn't cover it. But even if you kind of have something that's nagging and you want to go to a therapist, that would be a good place to start because we all need a foundation. And so as a therapist, a lot of times our foundation is like making sure your posture's good, working on body mechanics, making sure that you have the flexibility to do the activities you want to do, a lot of task specific training. So if you can't go to a therapist, maybe going to a trainer that actually does the sport just to
Exactly.
know like, okay,
Exactly.
what are the proper mechanics, what kind of movements am I going to be doing? And so, I mean, yeah, it's just, I guess it's just kind of hard to say like one specific thing because it's like we're using our bodies every day.
Yeah.
And a lot of times we're not thinking, especially if it's not high intensity, like maybe around the house, like you're doing laundry, doing cleaning, things like that. We don't think about it. But then if you're going to sport, that's just different
Hmm.
movements. So I think just, even paying attention to how you're moving at home. If you kind of
Very
irk
true.
your back,
Yeah.
like what was I doing when I irked my back? And that's why I feel like the therapist perspective would help, or like a train, like someone that can see you from the outside, because we can't see ourselves. I don't know if that is kind of what you were looking for, but I mean, I think
No,
that's just important, just to get with a professional who knows what to look for that can help you prevent injury.
right? An expert that can help you prevent injuries, thinking about the whole picture. That's what I'm
Mm-hmm.
I'm hearing from what you're saying. Somebody that thinks about the
Yes.
whole picture, not just,
Yeah.
you playing pickleball, but thinks about, like what you do at home. What are you doing at
Mm-hmm.
home before you even get to the pickleball field? What are you doing at home before you
Right.
even get to your activity or your hobby that
Mm-hmm.
you're trying to participate in?
Mm-hmm.
Also thinks about your past injuries and
Right.
things
Oh,
like
yeah,
that,
that's good.
right? And one thing that I'm a physical therapist. So yes, I'm a little bit biased too.
Yeah.
Um, we have a lot of schooling and knowledge, so I'm gonna be a little biased, sorry guys, but I'm tracking with Dr. Chastity right here, but
Yeah.
DPT here. But one thing that you mentioned I think is really important is that you don't just go to the physical therapist just when you're injured or when you have pain. There's a lot of things that you can do before that even you get to injure yourself, right?
Yep.
Before you get to pain, before you get to injury. So that we call it prehab, right?
Mm-hmm.
And I think that a lot of times people don't realize that we're really good also after you finish with us, like for
Right.
maintenance and things like
Yep.
that, right? Because
Really across
it's
the lifespan.
across the life, exactly, right? Goal life therapy, right?
Yeah.
That's what it's, yeah, you know what I mean? And you guys are listening to this podcast. This is about building body resiliency and life for the whole lifetime. We want you to play better, play without injury, play free. Right, that's
Mm-hmm.
that's the tagline of this podcast here. Man, what an awesome discussion. So what would you say for those older adults that are trying to get into an activity, but they have a fear of injury or a fear of pain?
Well, I would say community is really helpful.
Mhm.
Like there's programs like Silver Sneakers where you go and
Great
there's
program.
usually professionals there that are helping to organize the events. Like they can watch you while you do your exercises and things like that. You can even just go to a class and observe and just kind of sometimes just seeing other people that are your age that are doing these same activities, it kind of inspires, oh, like maybe I can.
That's
Um,
awesome. Yeah.
yeah, because I mean, if we're meant to move, and just like with babies, they walk and they fall, and sometimes they
Mhm.
may hurt themselves, but it doesn't mean now I can't do anything. Our
Yeah.
bodies are
Falls are gonna
resilient.
happen,
Yep,
you know?
yep, yeah. So as you said, you want to build resiliency. So just think of it this way. If you don't do anything, it is not going to help you. It's not going to help anything. It's not going to build anything
Yeah.
up in you to be able to handle the different stresses that you may encounter, literally, like in life, not just sports. But if you start to kind of train your body, I kind of have a saying, train up a body in the way it should go. It doesn't even matter when, then it's going to
Hmm.
support you in the times of need.
Man, so much good stuff in there. So obviously you love the older adult population. You're an expert not just for older adults. She also treats other people, by the way,
Mm-hmm.
the whole lifespan. But so you have over a decade of experience. What do
Mm-hmm.
you think? Did you always want to be a business owner? And secondary question to that is, where are you now versus where you were when you first started?
Oh man. Okay. So no, absolutely not. I wanted to go to work, do my job, come home, like help people come home. Like I'm just not business savvy. That's not really who I am.
Because you
Uh
really care about
Deep
people. That's the
inside, I do.
thing.
I just really care. But then you get people ask you like, do you see people at their houses? Do you do this or that? And then just some life circumstances really just opened doors for me to explore it more. I was kind of, I don't want to say on a rat wheel, but I was definitely in a comfortable routine for
Mhm.
years of working, doing my job, loving it. But I also began to see a need when we discharge our patients. And I'm like, I would just be thinking, like, what happened to them? Are they still getting the therapy that they need? Like,
Yep.
I see
Very
so much
important.
potential in them and I don't want them to fall off. So that's where my desire to become an entrepreneur came in.
Mhm.
And then, secondly, now, I mean, I'm actually a full time caregiver. So I have the privilege of
Wow.
getting more experience of caring for an older adult that actually can't do sports, can't mobilize on their own. But we're humans. As a therapist, we don't just treat the physical, we treat the whole person.
The whole person. Yep.
So I've gotten the opportunity to see what that's like and even what caregivers go through and just being knowledgeable about that. So I think it's my practice now is just even more well-rounded because of life and the things that I've learned. So I'm really pushing towards, and I'm glad to see even on social media, like more older adults are taking control of their life and not just saying like, well, there's nothing I can do or it's over, or if I get diabetes, I can't do anything, or heart failure. Like, it's like, no, you can still do it. And so right now in my life, that's where I am. It's like, we get to treat whole people and we can do it outside the facilities, in the world, in their homes, in sports, everywhere. And so I'm just excited about that.
Wow, you're an angel, right? For taking care, full-time caregiver, friends like this. So I'm sure you've learned so much from seeing the other perspective. And
Yeah.
just like Dr. Chastity said, thinking about the whole person, but the whole person also has a whole community of people, a whole
Yes.
household, right? Sometimes we don't think about the social aspect of pain and injury, right? Right? It's more than
Yeah.
just I have back pain, I have knee pain, or something's wrong with my body. It's like now I can't
Mhm.
participate. I can't take my kids to school. I can't take care of
Right.
them anymore, right? Now I'm limited in my social life, with my
Mhm.
friends, my coworkers, people are giving me unsolicited advice.
Right. Like, I
Yeah,
don't need to hear that.
sometimes, a lot of times, right? And so it's not just, yeah, we think about, oh, my body part hurts, but it's a whole body, it's a whole world of things that could happen. So it's really good to find an expert that thinks about these things, right? So I'm so glad that, we have somebody like Chastity that thinks about that, and that's who you, friends, that's who you want to look for to help you get better, and not just heal, work on one body part, somebody that thinks about your whole entire being and your social life too, right? Who are you when you're not just there for treatment, or they're just texting you for, your workout or something like that, or whatever they're doing with you? I would advise you, even if it's not with any of us, with myself or Chastity, you look for a practitioner that thinks about your whole life, really. Thinks deeper than just, you being a body part or just a back pain. You know what I mean? They just put a
Right,
label on
right.
you. You're more
Not a
than just that.
diagnosis.
Exactly. You're not a diagnosis. But I want to hit on something that just kind of got me in here. You talked
Okay.
about, obviously we're talking about adults returning to sport, but there's a whole spectrum of things that can happen, like somebody that loses their ability, disability.
Mhm.
We really, especially in this specialization, we learn that, in different, there's different levels of ability. And really, just because you're chair bound, like say you're chair bound, there's things you can participate in, right? There's things that you can work on to get better. There's things that you can participate in, and even at that level, don't think that, let's say you have a disability or you're weak, there's things that you can still work on. Do you have anything to add, Chastity, about just people that may not be able to, be a full, a pro at like pickleball or another sport, but they can still be active even, even from a chair? Do you have anything to
Yes,
say about that? Yeah.
absolutely. Well, I'm gonna say like it froze for me for a moment, so I don't know if I got the whole spiel, but I thank you for rephrasing the question again.
Yeah.
One thing that I saw this summer for the first time, which I'm like, dang, like why didn't I even think about this? The Paralympics.
Yeah.
If you even just Google the Paralympics and just the things like people that can't move their head and they can only move a finger
Or
were
they have a
playing
chronic
sport.
illness, right?
The Paralympics are a great example of people of like different levels being able to do many different sports, not just physical, but like kind of mental sports as well. So I like to say if you're alive, like there's an opportunity for you to do things that you enjoy. I think the biggest thing that helps with that is finding a community of people that maybe are in the same situation or had experiences. Nowadays there are a lot of support groups, so I would just encourage you to like look into different support groups or programs in your area because it kind of just, again, just like with exercising or going to see people your age working out, it just kind of helps to lift you up. We need each other. And so I think that is a big help if you're wanting to do something that you enjoy and you feel limited.
Mm.
As a therapist, there's ways to modify activity or to make it so that you can do what you want to do. Don't give up on yourself. Find someone
Let's
who's going to push
go.
you and help you, and yeah, you can get it done. You can get it done. It may look different, but don't don't give up completely.
Let's go. Let's go. I love that. I love that. So you obviously talked about some community. We've been talking about community and community resources, but do
Mhm.
you have any like book recommendations or online resources, videos, or anything that you can recommend for our listeners?
So I have three. Two are books. One is the internet, but it's a government website. So the CDC.org is a really good resource for like if you have medical conditions and kind of like who you can like in directing who you can go to help you manage it. A lot of times the therapist will be in there as part of your plan, but I think they give a good overview and education on like maybe what you're dealing with, maybe questions you can ask when you go to the doctor, so that when you do want to do your activities, you're kind of prepared. Like you're not just going in blind. You know what your limits are and kind of how far you can push. The other resources, there's a book called Good Energy.
Good energy.
The surprising connection between metabolism and limitless health, and that's by Dr. Casey Means. Our nutrition is a big part of being able to do the
Such a big
sports and the
part.
activities you
Yeah.
want to do and live. So her book is really good about how to improve your metabolic health, because a lot of our diseases, the diabetes,
Mhm.
is part of like a metabolic syndrome. Sorry, a
There
lot
you
of
go.
conditions
Yeah.
that affect our organs' ability to process things correctly. When it doesn't happen, we get sick. So this is a great resource. And then the other book is by Dr. Gabrielle Lyons. It's called Forever Strong, a new science-based strategy for aging well. Eat your protein, lift heavy. That's
Let's
pretty much
go,
what it
baby.
is.
Yeah,
So those
and
are my three.
those are great, amazing recommendations. And as you know, with this podcast, A Strong Serve, we don't just want to talk about building muscle and training and just rehab and prehab. We want to, again, we're thinking about the whole body. Like Chastity
Mhm.
was saying, with nutrition is such an important part. So friends, please check out those recommendations. They sound amazing. I think I'm gonna check them out myself as well. And I guess I always ask this for my guests. Do you have any stories you want to tell us? Any success stories? Any patient that impacted you a lot or if you really connected with or you were able to help that you can share with our listeners?
Yeah. So I had a patient. I worked in a long-term acute care, and this was like during COVID time. And this patient was on 50 liters of oxygen. And during COVID, we were just figuring things out, like what can people do? Like, should you be moving even if you're on all this
Hmm.
oxygen? Well, just to put it this way, LTAC is just a small part of a long list of rehab this lady had to go through. But we were kind of at the beginning stages, my partner and I, Maria, who's an OT, we helped her to get to where she could tolerate transfers, like getting out the bed and walking like 10 to 15 feet. And that was a
Hmm.
big thing for her because she's on 50 liters of oxygen. I think she got down to like 8 by the time that she left us. She was
Wow.
able to go to the rehab, to inpatient rehab, where they do 3 hours of therapy a day. It's intensive, but they're professionals. And so they know how to gradually progress you. And she was able to go home. So that was one of the biggest ones because it was during a time where we just didn't know what was going on with COVID. And she was a phenomenal success.
Wow, what a great story. I think the thing that resonates with me about that story, besides the awesome result of it, it's the baby steps. It's one
Mm-hmm.
small step at a time. I think I heard of a study recently that if you go up a flight of steps, you gain 4 seconds in your life.
Wow.
So you can
Wow.
start today, my friend, right? We can start today
Baby
to
steps.
baby steps. Don't feel discouraged if you're not at a pro level just because you started yesterday, it takes time, and any little bit helps. I don't know if you heard the story of the 80-year-old marathoner. She started when she was 80 years old, and now she's run like 10, 20 marathons. She's a nun. We worked at St. Catherine's Rehabilitation Hospital, so yeah,
Yeah.
thinking about that. Yeah, and the nun, I forgot her name, but it's definitely doable. You can build body resilience at any age. right?
If
That's
you're
the message
alive.
for today. If you're alive, you can build body resilience at any
Yes.
age. Wow, I'm so happy and honored that you came on the podcast and so much knowledge and good things that our listeners can take home with them. So I guess I want to ask you, how can people find you? Where can they connect with you?
Okay, so I am on Facebook, Instagram, LinkedIn, and YouTube. You can look up Dr. Chastity Guillory, and it should take you to my social media handles. I don't think there's a lot of people with my name out there, so just Dr. Chastity Guillory, and yeah, so easiest way. And all of my profiles are linked together, so if you find one, it'll be easy to get to the others too.
Awesome, awesome. Well, make sure you look her up, look at her content. I'll be going ahead and posting the episode as well. And the episode notes should also have a lot of her information as well and how you can contact her through email. But make sure you look for that Facebook and that Instagram as well. And well, hey, thank you so much, Chastity,
Of
old friend, for
course.
coming over here and blessing us with your knowledge and your presence. And hey, we're gonna continue to be resilient. We're gonna continue. If you're alive, you can do it,
Yes,
okay?
absolutely.
That's the quote of the day, okay? Well, thank you so much for joining us and hey, God bless.
Of course. God bless you.